4 signs your dental habits are shaping your future oral health. Have you ever thought about how your dental habits today might affect your smile and your health decades from now? In your teens and 20s, your teeth may seem invincible, but the choices you make now are quietly shaping your oral health for life. Good dental habits can prevent cavities, gum disease, and even serious conditions like heart disease linked to poor oral health, while bad habits can set you up for painful, costly problems down the road. Some young people maintain strong, healthy teeth well into adulthood, while others start noticing issues, bleeding gums, sensitivity, or even tooth loss, far sooner than they expected. The difference often lies in a few key signs, subtle indicators that reveal whether your dental habits are protecting your teeth or putting them at risk. In this guide, we're going to explore 4 signs that your dental habits are shaping your future oral health. These aren't guesses. They're backed by recommendations from the American Dental Association, ADA, and recent dental research. By the end, you'll know exactly what to look for, how your daily choices are impacting your teeth, and what you can do to ensure a healthy, confident smile for years to come. Stay with us until the end, because you might be overlooking small habits that could make a massive difference. And once you recognize these signs, you'll have a clear path to stronger teeth and better health. Let's dive in. Sign 1. Irregular brushing habits. The first sign that your dental habits are shaping your future oral health is irregular brushing. Specifically, brushing less than twice a day. Brushing your teeth twice daily with fluoride toothpaste is the cornerstone of oral health, as it removes plaque, a sticky film of bacteria that forms on your teeth and gums. According to a 2021 study in the Journal of Dental Research, inconsistent brushing allows plaque to harden into tartar, leading to cavities, gum disease, and enamel erosion over time. If you're not brushing twice a day, you're already putting your teeth at risk. Picture 2 teenagers, Alex and Mia, both 16 years old. Mia brushes her teeth every morning and night, using a soft-bristled toothbrush and fluoride toothpaste. Her teeth feel clean, her breath is fresh, and her dental checkups are always smooth. Alex, on the other hand, brushes only once a day, usually in a rush before bed, and sometimes skips it altogether. He's starting to notice a yellowish tint on his teeth and occasional sensitivity, but he shrugs it off as no big deal. Over time, Mia's consistent brushing keeps her teeth strong and her gums healthy, while Alex's irregular habits lead to plaque buildup, early cavities, and the beginnings of gum disease. Irregular brushing isn't just a minor oversight, it's a direct threat to your oral health. Plaque that isn't removed daily produces acids that erode enamel, the protective outer layer of your teeth, and irritates your gums, setting the stage for gingivitis or worse. If you're brushing less than twice a day, or if you've noticed your teeth feel fuzzy, or your breath isn't fresh, it's time to step up. The good news? It's an easy fix. Commit to brushing for 2 minutes, twice a day, using a fluoride toothpaste to strengthen enamel. Use a timer or play a song to make it fun, and consider an electric toothbrush for better plaque removal. If you're already brushing twice daily and your teeth feel clean, that's a powerful sign you're on the right track. Ask yourself, are you brushing twice a day, every day, or are you cutting corners? Your brushing habits today are the foundation of your oral health tomorrow. If you're finding this valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed, hit that subscribe button and turn on the bell so you don't miss our future content. Let's move on. Sign 2. Skipping flossing. The second sign your dental habits are shaping your future oral health is skipping flossing. Flossing daily removes food particles and plaque from between your teeth and along the gum line, areas your toothbrush can't reach. According to a 2020 study in periodontology, neglecting flossing allows bacteria to thrive, leading to gum inflammation, gingivitis, and eventually periodontitis, a severe gum disease that can cause tooth loss. If you're not flossing, you're leaving your gums vulnerable to serious damage. Imagine 2 young adults, Chloe and Ethan, both 21 years old. Ethan flosses every night, using dental floss or a water flosser to clean between his teeth. His gums are pink and healthy, and his dentist always compliments his oral hygiene. Chloe, however, never flosses. She brushes twice a day but skips flossing, thinking it's not that important. Lately, she's noticed her gums bleed when she brushes, and they feel tender, but she assumes it's normal. Over time, Ethan's flossing habit protects his gums and teeth, while Chloe's neglect leads to early gum disease, with red, swollen gums that could progress to more serious issues. Skipping flossing is like leaving half your teeth uncleaned. It's a major gap in your oral care routine. Food particles and plaque left between teeth feed bacteria, which produce toxins that irritate your gums and weaken your tooth structure. If you're not flossing daily, or if you've noticed bleeding or tender gums, your oral health is sending you a warning. The fix is simple but critical. Start flossing once a day, ideally before bed, to remove debris and plaque. If traditional floss feels tricky, try floss picks or a water flosser for convenience. Be gentle to avoid irritating your gums, and stick with it. Your gums may bleed at first, but should improve within a week. If you're already flossing daily and your gums feel healthy, you're giving your teeth a major advantage. Reflect. Are you flossing every day? Or are you skipping this crucial step? Your gums today depend on your flossing habits. If you're finding this helpful, please comment number 2 below to let me know you're here. And if you haven't subscribed, subscribe and turn on the bell for more content like this. Let's keep going. Sign 3. High sugar intake. The third sign your dental habits are shaping your future oral health is a high sugar intake, especially from frequent sugary snacks or drinks. Sugar feeds the bacteria in your mouth, which produce acids that erode enamel and cause cavities. A 2022 study in dental clinics of North America found that regular consumption of sugary foods and beverages significantly increases the risk of tooth decay, particularly in young people whose enamel is still developing. If your diet is packed with sugar, your teeth are under constant attack. Consider 2 teens, Ryan and Ava, both 18 years old. Ava enjoys a balanced diet, snacking on fruits, nuts, and water instead of sugary treats. Her teeth are strong, and she rarely needs dental work. Ryan, however, drinks soda daily, munches on candy between meals, and loves sugary energy drinks. He's starting to notice sensitivity in his teeth and has had a couple of cavities, but he thinks it's just bad luck. Over time, Ava's low-sugar diet protects her enamel and keeps her teeth healthy, while Ryan's high sugar intake leads to more cavities, weakened enamel, and potential tooth loss. High sugar intake isn't just about cavities. It's a long-term threat to your oral health. Every time you consume sugar, bacteria in your mouth create an acid attack that lasts about 20 minutes, weakening enamel and making your teeth more vulnerable. If you're constantly sipping sugary drinks, eating candy, or snacking on sweets, your teeth never get a break. The good news? You can reduce the damage. Limit sugary snacks and drinks to mealtimes, when saliva flow is higher to neutralize acids. Rinse your mouth with water after consuming sugar, and wait 30 minutes before brushing to avoid damaging softened enamel. Choose low-sugar alternatives like fresh fruit or unsweetened tea, and read labels to spot hidden sugars in processed foods. If your diet is low in sugar and your teeth feel strong, that's a great sign you're protecting your oral health. Check in. Are you consuming sugary foods or drinks multiple times a day? Or are you keeping sugar in check? Your diet today shapes your teeth tomorrow. Sign 4. Avoiding dentist visits. The fourth and final sign your dental habits are shaping your future oral health is avoiding regular dentist visits. Annual or biannual dental checkups allow professionals to catch early issues like cavities, gum disease, or misalignment before they become serious. According to the American Dental Association, 2023, skipping these visits increases the risk of untreated decay, which can lead to root canals, tooth loss, or even systemic health issues, like heart disease linked to oral bacteria. If you're not seeing a dentist regularly, you're gambling with your oral health. Picture 2 young adults, Sophie and Noah, both 23 years old. Noah visits his dentist twice a year for cleanings and exams. His dentist catches small issues, like a tiny cavity or early gingivitis, and fixes them quickly, keeping his teeth in top shape. Sophie, however, hasn't been to the dentist in 3 years. She feels fine and assumes her teeth are okay, but she's unaware of a cavity growing in a back molar and early gum disease that could have been treated easily. Over time, Noah's regular visits ensure his oral health stays strong, while Sophie faces painful, expensive treatments for problems that could have been prevented. Avoiding dentist visits is like driving a car without ever checking the engine. Sooner or later, something's going to break down. Dentists don't just clean your teeth. They use x-rays, exams, and professional tools to spot problems you can't see or feel. If you haven't been to the dentist in over a year, or if you only go when something hurts, your oral health is at risk. The fix is straightforward. Schedule a checkup today, even if you feel fine. Ask about sealants, fluoride treatments, or other preventive measures to protect your teeth. If you're seeing your dentist regularly and getting clean bills of health, you're setting yourself up for a lifetime of strong teeth. Reflect. When was your last dental visit? And are you due for a checkup? Your dentist visits today are critical for your oral health tomorrow. Final thoughts. Now that you've learned these 4 signs, take a moment to evaluate your dental habits. Are you brushing twice daily, flossing, keeping sugar in check, and visiting the dentist regularly? Or are you seeing warning signs like bleeding gums, sensitivity, or overdue checkups? The beauty of these signs is that they're not just red flags, they're opportunities to take control. Your teeth are a lifelong asset, and the habits you build in your teens and 20s can prevent painful, expensive problems later. If you've noticed any of these signs, don't wait for a cavity, gum disease, or tooth loss to force you into action. Start brushing twice a day for 2 minutes, floss daily, cut back on sugary snacks and drinks, and book a dental appointment. These small steps can save your smile and your wallet. Your oral health isn't just about your teeth. It's linked to your overall well-being, from confidence to heart health. If you found this valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed, subscribe and turn on the bell for more content to keep your smile strong and healthy. Here's to a lifetime of confident, healthy teeth.